All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
Lulu Money, Snehapurvam.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Good evening viewers, welcome to this week's episode of BMC Global Live Alhilal Health World, nothing but lifestyle. Myself Mareena Francis. So we are back again in this week's episode of Health World. We are taking tiny steps towards creating a healthy world. So in this week's episode, for discussion we have taken up the topic thyroid disorders, and in this week we will be specifically dealing with hypothyroidism. It is definitely one common health issue among us. We will be trying to cover many queries related to the topic. First, let me introduce to you the doctor joining with us today, Dr. Vidya Vijayan.
Hello.
She is a consultant in internal medicine with over 8 years experience in the field. She is currently working at Alhilal Hospital, Mohrak branch. So let us move ahead with the discussion on today's topic, hypothyroidism.
Hello, Mareena.
Hello, doctor.
Yeah.
Good evening. Welcome to
evening.
Health World.
Yeah, thank you.
Doctor, so the topic today is specifically hypothyroidism.
Yes.
Before getting into hypothyroidism, just tell us, to understand clearly, what is the role of thyroid gland and how important it is for our body.
Yeah, sure. That's actually, as you said, the hypothyroidism is a very common chronic disease that we usually encounter in our daily practice.
Yes.
So, to know the importance of that, first I will discuss what is thyroid gland and what is the importance of that.
Yes.
Okay.
Okay.
So, thyroid gland is a butterfly shaped gland which is situated in the front of our neck. Okay. So this produces very important hormones like T3 and T4. Okay, these hormones are very crucial. So this controls the body's metabolism. In simple, it controls our body's metabolism. So this has a control over each and every cell of our body and all the vital organs. These hormones has a direct role over controlling our our cardiac function, respiratory rate, even our temperature, body's temperature. So this has a very crucial role in our daily functions, our functions of the body. So basically, if there is any change in the secretion of the level of the hormone, like suppose if our thyroid gland doesn't produce enough amount of thyroid hormone, so that causes hypothyroidism. Okay, or if it secretes more than what is needed for our body, also that is also a problem. Okay, so that is the term we call hyperthyroidism. So both is not good, either it is very low or very high. So it has to go in a median level. So so that's what it is, a very important hormone for our normal function.
Okay. Generally, who all come up with this problem of hypothyroidism?
Actually, as I told, hypothyroidism is our thyroid gland is not producing adequate amount of thyroid hormone. Okay, so here this is a very common condition. Usually it is more common in ladies. Okay, like middle age and adult women are more commonly affected. Okay, but even we can see this in children also. Sometimes newborn, even children born with hypothyroidism. Okay, so that condition is called congenital hypothyroidism. Okay, and even men are also affected. So this can affect all both females and males and all age groups also, but more common in ladies, especially in the middle age and adult women.
Okay.
Yeah.
Doctor, is there any reason why it is more common in the female population?
Nothing like that, but usually more commonly seen in ladies.
Okay.
Yeah, and the causes are mainly like autoimmune hypothyroiditis, or we call it as Hashimoto's thyroiditis. Okay, so in this our own body's immune system produces antibodies that damages our thyroid gland. Okay, so in this situation, when our thyroid gland is, cells are damaged, it produces less amount of thyroid hormone. So this is the most commonly seen condition. So this is the most this is a condition we usually see in our day-to-day practice. It's very common. Okay, so other causes, if I say, that is sometimes when we take some medicines for hyperthyroidism. Okay, some medicines that are taken for hyperthyroidism will actually damage the thyroid cells to to produce to decrease the amount of thyroid gland, decrease the amount of thyroid hormones to be produced. Okay, so in such a case it can go for hyperthyroidism later. Okay, so that's one other reason. And sometimes some radiation treatment which is done for the head and neck for some other causes, like some other cancers and all, when they do some radiation treatment for head and neck, that can also result in hypothyroidism. Okay, and other reason is like some medications. Okay, so there are certain drugs which can cause hypothyroidism. Okay, and One more, iodine deficiency. Okay, so iodine deficiency is one of the other common cause of hypothyroidism. But after the introduction of iodized salt, and we are using fortified iodine supplements in the salt, you know, the introduction of that, the cause of hypothyroidism, such as iodine deficiency, has relatively come down.
Okay.
Yeah.
So doctor, that was in detail about the causes of
yes, that is the main causes. So first is autoimmune or Hashimoto's thyroiditis. That is the commonest cause, and other things are, as I said, previous treatment to the you know, for hyperthyroidism, treatment taken for hyperthyroidism, or any head and neck radiation done before, or thyroid surgeries also. Okay, sometimes surgeries to the thyroid can also cause permanent destruction and can result in hypothyroidism, and as iodine deficiency, one other cause. Yeah.
So doctor, to identify this disorder, we need to understand what are the symptoms of
yes,
thyroid
of course,
disorder.
yeah.
So what are the symptoms that can be shown in a patient?
Yes, see, as I already told, this hormone is very important for to control our body's metabolism. Okay, so when this is deficient, so overall our body's metabolism is slow. Okay, so usually the patients will present with tiredness, lethargy, or they feel bloated, weight gain, and they have intolerance to cold. They won't be able to, you know, withstand the cold temperature, and dry skin, and other thing is that increased hair fall, brittle hair, constipation. So these are all the common symptoms that we see. But see, all these symptoms which I told now, you know, they have an overlap with other diseases also. So they're very common. So so that is the reason why we say when you experience all these symptoms, you should go to the doctor, and the doctor should find it out whether there is hypothyroidism. Yeah. So these are the most common symptoms that we usually see. Yeah.
So we have only dealt with the very few questions of what hypothyroidism is, what are its common symptoms, and what can cause this. We need to get into the treatment options, but before that we are going in for a very short break. Stay tuned.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Welcome back. You're watching BMC Global Live Alhilal Health World. In today's episode, we have Dr. Vidya Vijayan with us. We are discussing on the topic hypothyroidism. So let us move ahead with the further questions. So doctor, we heard about the common causes and symptoms of hypothyroidism. So how do we diagnose hypothyroidism?
Yeah, because Mareena, I was saying that because all these symptoms are almost have an overlap with other diseases. Okay, so very common symptoms. So what we have to do is, it's very difficult to diagnose only with the symptoms or physical examination. Okay, so we'll have to go for blood test. Okay, so the blood test that we usually do is TSH. Okay, that is a thyroid stimulating hormone test. Okay, and other tests are to look for the thyroid hormone levels. We'll look for free T3 and free T4 levels also. Okay, so the TSH is the basic test that we do. Okay, this is very sensitive also. And here, if the TSH level is high than the reference range, that means it is hypothyroidism. So this is usually always a doubt for, patients always have a doubt for this actually, because whenever the level goes high, it is hypothyroidism. When the TSH level goes high, it is hypo. Okay, because TSH is actually a stimulating hormone that is from the pituitary brain. Okay, so that is actually giving signal to your thyroid gland that the hormone production is less and you need to produce more. So that is why the TSH level goes high.
Okay.
So that is when we check for hypothyroidism, if the TSH level is high, we will diagnose it as hypothyroidism. And sometimes to look for the specific cause of the hypothyroidism, like as I already told, autoimmune or Hashimoto's thyroiditis and all. So in such a case, we may have to go for there are specific antibodies test also that we will do. Okay, so this is the common diagnostic test that we use for hypothyroidism, other than the symptoms and the physical examination.
Okay.
Yeah.
Doctor, so when you said about blood test, a common query that we hear is, should we come fasting for the blood test for thyroid?
Yeah, that's a very good question, because always patients ask that question, because there is you can come in fasting or non-fasting. There is no specific rule like that. You can do the blood test both in fasting and non-fasting. Okay. And next is, you can do the test morning, afternoon or night, no problem. Okay, you can do the test at any time and either fasting or non-fasting.
Okay. So doctor, you spoke about the causes of hypothyroidism. One common doubt with everyone is, genetically can we get this disease? Can it run in families? Yes,
it can run in families. The reason why I told Hashimoto's thyroiditis or autoimmune thyroiditis. Okay, so this can run in families. This has a genetic predisposition. So this is the reason we see mother has, daughter has, sister has. So that is because it can run in families. This cause, the other causes and all, that is depends. I told that is different causes. So only this can run in families, and this is very common. This is the commonest cause of hypothyroidism. Yes. So that's the reason. Yeah.
Okay. So doctor, once we diagnose hypothyroidism, how do we proceed with the treatment of it?
Hypothyroidism, as such, the condition is very simple, as I told, because there is a deficiency of the thyroid hormone. Okay, the body won't secrete enough amount of thyroid hormone. That is the problem here. So the remedy is very simple. Only we have to replace the thyroid hormone which is deficient in our body. Okay. So the option, there is only one treatment, that is we have to replace this hormone. Okay. So this is we are giving it as in the form of synthetic form, that is the oral tablet form is available. Okay, which is called levothyroxine. Okay. So we have to give this as treatment. So that is only a treatment option available, and there is no harm in this. This is just the replacement of our normal thyroid hormone, which the body will otherwise produce. We are giving it as in the tablet form. It is a synthetic preparation of our thyroid hormone. That's all.
So doctor, as you said, oral medication is the one and only treatment for this.
Yes.
So is there any side effects for such medication, or is there anything else we have to take care while taking such a medication?
There is no side effect for this medicine as such, because I told this is just the replacement of what our body lacks. Okay, our normal thyroid hormone is being replaced in the synthetic form. That's all. And but one thing that patient has to do is that always take the medicine in an empty stomach. Okay, they have to take the medicine at least 1 hour before they take their meal. Okay, so so that's the reason why we always say take the medicine as soon as you get up, and so that before you take your breakfast. The reason why we are saying this, because the food that we eat, okay, can interfere with the absorption of this medicine. Okay, so if you take along with the food, the medicine won't be absorbed properly in your body. So that is the reason we always say take this medicine in the empty stomach. And always don't take other tablets like antacids, multivitamins or iron and calcium supplements along with this medicine. Okay. So if you are taking, if you are regularly taking some iron and calcium supplements or other multivitamins or antacids, take at least 3 hours after you take this thyroxine tablet. Okay. So the reason is mainly because that will again affect in the absorption of the thyroxine tablet. Yeah.
Okay. So doctor, as such, does diet have any relation to hypothyroidism?
Actually, once the patient is on medication, like when the patient is taking the levothyroxine tablet, they can take any diet, no problem.
Okay.
There is no role in that. You can only thing, you make sure you take the tablet properly. You have to replace the hormone which is lacking in your body.
Okay. Other than that, can any food items trigger hypothyroidism?
Yeah, there are some but that doesn't have a role when you start the medicine. Yeah, when you take the medicine, you can when you are on medication, they can take any diet. That's okay.
Doctor, another very common doubt that many people would be having is they are hesitant to start medication because doubting whether they have to take it lifelong.
Yes.
This medication, should we take it lifelong?
Most of the time patients will have to take this for lifelong. Okay. So mostly the causes of hypothyroidism, as we already discussed, it can cause permanent destruction of the cells and reduction in the thyroid hormone production. So they may have to take this medicine mostly for lifelong, but the dose can change. Okay. So once when we discussed about how to diagnose, I told when the TSH level goes high. When the TSH level goes high, we call it as hypothyroidism. So according to that level, the level of that TSH and your free T4 level, your doctor may prescribe an initial dose. Okay. So mostly when we start with we may start with the low dose. Okay. And when even in elderly individual and all, we are not supposed to start with a very high dose initially itself. So the doctor may according to the age group and the level of the TSH and all, that your doctor will, according to the requirement, they will start in a low dose. Okay. So we may have to do initially, we may have to do blood test frequently, like after 6 weeks of interval, your doctor may call you for a NETS test. Okay. And this is mainly even after the starting of the treatment, it can take some days, or so for some people it can take even up to 3 months for your TSH to come back to normal.
Okay.
So once your TSH is normal and your dose is now stabilized, then you don't have to do frequent blood test. Okay. You can do 6 months or once in a year is also fine, but you should not continue with the same dose for lifelong, because your requirement may vary. So only you should not self adjust the dose, only your you should go to your doctor, and your doctor should adjust the dose. So there are doctor should look at interpret the blood report and your symptoms and your signs, and according to that they will adjust the dose. Okay.
So even if the TSH level comes to normal, we still have to take the medication.
Yes, Mareena, that is the every patient will ask me that question. Actually, my TSH is now normal, so why do I have to continue? So your TSH is now normal because you're taking the medicine. Yeah. So when you're taking the medicine, it will be normal. So once you stop it, then it can again go back to your other state.
So once the TSH level is normal, the symptoms won't be there.
Symptoms will won't be there. Yeah, it will reduce.
Okay.
So that is again other question is like always weight gain is a very common symptom that usually patients will come to us. So usually like once your thyroid hormone levels are normal, like the TSH levels are normal, the weight gain should also go. They should go, but if you still have a tendency to gain more weight, and then that your thyroid is not the cause of that. You have to you have to go to your doctor to find out the other causes. There can be other reasons why you are gaining weight. Okay. So symptoms should reduce once your hormone levels are normal. Yeah.
Okay. Doctor, also another common query is while we come for testing for hypothyroidism, on that day should we stop the medication?
No need. You can take the medicine when you come for the blood test.
Okay.
Yeah.
Doctor, can you elaborate on hypothyroidism during pregnancy?
Yes, actually in pregnancy, it is very important to detect hypothyroidism. Okay. Because this thyroid hormone is very important for both for the mother and the baby. Okay. So initially for first to 3 months the fetus won't be producing thyroid hormone, so it is dependent on the mother's hormone level. Okay. So it is very important to check your thyroid level during your pregnancy. Okay. And hypothyroidism as such if before pregnancy itself, it can cause menstrual irregularities and even infertility. Okay. So once you are pregnant, you should check your TSH level. Okay. So nowadays it's a common practice that the doctors will check the TSH level during pregnancy. So this is mainly because, as I told, it is very important for the mother and for the growth and development of the baby, especially for the development of the brain and spinal cord of the baby. Okay. So if it is deficient, if the thyroid hormone level is deficient, it can result in severe dysfunction of the brain dysfunction of the babies. Okay. So very important for the development of brain in children.
Okay, so after testing, if the pregnant lady is detected with hypothyroidism, then is it safe to take medication?
Yes, it is absolutely safe to take the medicine, and they have to take the medicine. Okay. So here, as I told, the requirement is more than a normal individual. Okay, in pregnancy the requirement is more. So the reference range of the thyroid hormone TSH level itself is different. We keep in a different level because in the earlier trimester the requirement is more than the other trimesters. Okay. So the reference range, suppose if it is 4.5 when in other adults, this is kept at a level of 2.5. Okay. So the requirement is more and slightly hyper, we keep slightly hyper level, more we have to give than the other individuals. Okay. Because the requirement is more, and then as it is very important for the baby's development. Okay. And if otherwise also, if hypothyroidism is not treated, it can result in miscarriages and premature birth, low birth weight, and some other like causes increased blood pressure in mothers and all during pregnancy.
So doctor, if a lady is diagnosed with hypothyroidism during pregnancy for the first time, then still would the medication have to be continued after pregnancy as well?
Yeah, mostly. We may have to check. After the pregnancy also we will keep checking. Okay. So yeah, mostly it may be the first time that they would have detected. Yes, so that can be the cause. So we may have to continue. So after the pregnancy also we will check it, because usually after pregnancy there is a condition called postpartum thyroiditis. Okay, that is also a very common thing. After 6 months, there can be after 6 months of your pregnancy, thyroiditis there is a condition that can be mild inflammation of the thyroid gland, and there can be variation in the production of TSH or thyroid hormone. So sometimes they may even go for hyper. Okay. So initial there can be a stage of hyperthyroidism, and after that they can go for a hypothyroidism. So we have to check the TSH level and then decide. Yeah.
Doctor, after diagnosed with hypothyroidism, in case a person does not go with medications, then what could be the consequences?
If they don't take the medication properly, as we told, there can be so many complications, because as I told, this controls your heart rate, okay, respiratory rate, temperature, everything. So if it is not taken properly, the patient will be completely, the metabolism will be completely slow, okay. So the main complications what we see, it can even result in cardiac complications, cardiac failure, and sometimes a very severe condition called myxedema coma, okay. So there is a complete lack of thyroid hormone there, okay. And one more thing, this I didn't discuss before, so I just want to add this. Even thyroid hormones, if in hypothyroidism, if it is not properly controlled, even there can be changes in your cholesterol level, okay. So usually the cholesterol levels are high in hypothyroidism, okay. So that is because the thyroid hormone has a role in the metabolism of the cholesterol also. Okay. So if it is not controlled, the cholesterol level can also be high. So it's very important to take medicine for your hypothyroidism properly.
So doctor, we touched upon many queries regarding hypothyroidism. Can you sum up all of that as a takeaway message for our viewers?
So hypothyroidism is a very common condition we are encountering in our day-to-day practice. If any one of you are having these symptoms which I already discussed, please go to your doctor and check your TSH and thyroid hormone levels, and make sure you take the treatment properly, and never self-adjust your dose, okay. Always remember that, never self-adjust your dose. Thank you.
Thank you very much, doctor. Thank you for joining with us today and for answering all our queries. Hope all of you viewers found this episode useful and informative. Today's episode we dealt with hypothyroidism, so definitely next episode we are planning to take up on hyperthyroidism, so don't miss to watch. We'll be back again next week, same day, same time. This is Mareena Francis signing off. Till then, good night.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും.
ലുലു മണി സ്നേഹപൂർവ്വം.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.